If you're struggling to conceive after you've already had a baby, you're not alone. Secondary infertility, or the inability to get pregnant or carry a pregnancy to term after you've already had a child, affects millions of people. So let's talk about why this happens and what you can do about it. Lots of people assume that if they were able to get pregnant before, especially if it was easy, that it should be easy enough to do it again. But it's important to know that a lot can change over time. For example, I myself had no issues conceiving my first child in my mid-30s, but I did struggle in my late 30s when I was trying for baby number 2, and ultimately I ended up relying on what I froze to overcome secondary infertility. Secondary infertility is something I see all the time, especially for people that started their families in their mid to late 30s. One of the most common causes of secondary infertility is age-related decline. If you had your first child in your early 30s and now you're in your late 30s or even your 40s, we know that that can have a significant impact on the ability to ovulate a healthy egg from 1 month to the next. And it can make it harder to overcome with treatment, even IVF, because of the effect that age and time can have on our egg quantity and how many eggs we have to work with. So not only is there an increase in infertility, but we also see a higher risk of miscarriage because of the impact of age on our egg quality. There can also be other changes that happen to our bodies over time, such as structural changes from carrying the pregnancy itself, especially if there were complications that required a D&C, like postpartum hemorrhage or retained placenta, or things that progressed over time, like fibroids that grew into a position where the uterine cavity is affected, or they're large enough to start pushing on the uterine cavity, having prior infections. All of these are things that can prevent an embryo from implanting successfully or could interfere with the uterine cavity environment. Another thing that I see sometimes as a cause of secondary infertility that's not that common, but for some people who've had C-sections, there can be something called an isthmusele, where there's a collection of fluid in this niche or space that didn't heal quite properly after the C-section. So these are all things that can really occur as a result of a pregnancy and can contribute to secondary infertility over time. A lot of times there can be this misconception that because you got pregnant in the past, there's no way that you could have blocked tubes. But we know that there are disorders like endometriosis or pelvic infections or adhesions from prior surgeries that can lead to the obstruction of fallopian tubes that prevent the sperm and egg from meeting. So it's important to always reevaluate these things, even if in the past you were able to get pregnant. Chronic medical conditions like endometriosis can be progressive, thyroid dysfunction, diabetes, autoimmune disorders. All of these can get worse as we age and can make getting pregnant more difficult. And let's not forget about the partners. Sperm quality can decline with age, lifestyle factors, underlying medical conditions such as low testosterone, varicoceles, or chronic illnesses. Even if sperm quality was normal in the past, new issues can arise. Remember, men are always making new sperm every 72, 74 days, and so there's always room for fluctuation in quality. And it's important to also realize that as new parents, or people that are trying to balance it all, you can have increased stress, poor sleep, poor nutrition, and all of those things can contribute. I will say a lot of patients who come to me eventually to talk about secondary infertility do tend to go through a period of time when it almost seems like they're in denial. And I think this can be very tempting because your brain is telling you you don't have infertility, you were able to get pregnant before. But I think if there could be an age-related factor, in general, you really just don't want to delay, and it's important to have a low threshold to go see a specialist if you're under the age of 35 and it's been a year, but especially if you're over 35, you don't want to wait any longer than 6 months. And if you're in your 40s, I wouldn't wait longer than 3 months before seeing a specialist. And if you have irregular cycles or known gynecologic conditions like PCOS or endometriosis, it always makes sense to seek an evaluation sooner. Just because you got pregnant before in the past doesn't mean that you're gonna have an easy time again. Every attempt, every time, depending on where you're at in life, can be very different. But it also doesn't mean it's impossible. I've also had the converse be true, where people go through fertility treatments and then they're able to conceive on their own for baby number 2. So anything is possible, but it's important, if you're struggling, to know that you're not alone with this. This is not a rare problem, and there are a lot of options that can help you. If you've struggled with secondary infertility, I wanna hear about your experience. If you're comfortable, share in the comments.